Sends it back in front. Here's Kadri back.
If anyone that's had a surgical procedure done knows that it's a little bit overwhelming, facing injuries and rehabilitating injuries and spending lots of time with doctors and learning about your body.
Kadri, and he's hit hard to the boards by Kane on a penalty.
The number one priority in life should be your health.
It's not hidden that our healthcare is under stress, and we were looking at surgical care and how we were providing it, and came up with this concept that we can probably do more with less if we reorganize the care we give. The primary goal of this center is to provide surgical care that allows more readable access, that's not competing with very large surgeries that we do at LHSC.
I can't speak highly enough about the city and you know, everybody in the city to help me get to where I am today. That's where I was raised, that's where I grew up, and you know, it's a privilege and an honor for me to try to give back to the community.
We took this concept to him about 5 years ago. He said right away, if the goal is to help more people and treat more people, we're in. This is our pre and post holding area.
Wow.
So it's a 10-bed bay where patients would be brought in, prepared for surgery, and they would also be recovered in the same bed.
I like that.
Something unique about this is it's the same nurse that does their pre-operative and their post-operative care, so there's a lot of continuity of care, and patients tend to express great appreciation in that.
Oh, yeah.
This is one of our standard operating rooms, so it's a very modern operating room with all the necessary equipment. Here we'd perform orthopedic surgery, plastic surgery, general surgery are all performed in these rooms.
So my husband's having a fusion surgery. Would he have that kind of surgery here?
Yes, he would. So he would
Okay.
he would have it here for his foot fusion, I believe. So it'd be probably this exact room. So you come in here, and this is where the surgery is completed. We have a diverse amount of equipment to be able to do diverse amount of surgeries. So this center was really based on running a lean operation in terms of giving patients the care they provided. And by doing that, cost savings were upwards of 35 cents on the dollar per surgery, and on some it was greater than 50 cents on the dollar. That means you can increase your output by 30% or increase your output by 50%. So in the same funding envelope, you could have a greater throughput. Mm-hmm. So this is all the surgical equipment that's needed and kept in sterile condition in a very organized way. We map them to the operating rooms that they're going into so that they can be very quick and facile. Okay, so here's where all the real hard work is. The team in here takes all of the equipment, makes sure that it's sterilized to a standard, it's all appropriately wrapped, and the equipment here would be used to deliver to the operating room, which would be all of the instruments and implants that are being used in the surgery. So a very critical part of the operating room. Nothing could run without this. So this is currently set up for sports medicine, arthroscopy. This will be a hip arthroscopy surgery. These are their monitors. And again, so modern room that's meant to be able to do multiple capabilities in terms of outpatient surgery. And all of the rooms are based on a standard square footage with all of our equipment. I would personally say, as the director of the facility, that we couldn't have done this without Nazem and his family's generosity. So I want to send a heartfelt thank you.
I can't say enough about my excitement of the Nazem Kadri Surgical Centre. I mean, I don't know if I could say that enough. We've had a lot of great supporters in our corner that love this idea and love this project, and that'll take the surgery center to a new level. I just love this concept, and I can't wait for it to expand.